Space Coast here. It's been amazing to interact with the people that work here now and worked here in the past. And it certainly gets the innovation juices flowing. Here at Health First in Brevard County, when I came over, it was quite unique and shocking to be able to take care of these patients who worked on the Gemini program or the Apollo program, engineers that stayed locally. We were able to start kind of using that as a jump board to start some innovative processes. Before we got going out here, nobody was doing minimally invasive heart surgery in Central Florida. And now we have probably the busiest program easily. We have a 3-star rating for our bypass surgeries and our double valve surgeries. So we're able to not only provide the quality documented through the STS, but we also provide an innovative care spectrum where we're able to offer almost all of the FDA-approved modalities for treatment to patients, including the less invasive and minimally invasive options.
The Cardiothoracic Surgery Department of Health First has a collection of highly experienced providers, both on the physician side as well as on the support system of advanced practice providers. We are poised and directed towards modern applications of technology to the benefit of our patients' population.
With the advanced technologies that we have available, we're routinely seeing patients in their 70s and 80s and even 90s undergoing some sort of heart operation. And so you have to take a comprehensive approach to that patient.
The older we get, the more complexity of medical conditions we have and multiplicity of medical conditions. And because of that, a team approach is always very important.
The team here is situated in such that we kind of describe it as an APP-centric team. We may see patients from the beginning until all the way to the end, and we're a familiar face. We're a point of contact for not only the patient, but their family. And so we spend a great deal of time educating patients about the disease state or the disease process preoperatively and help intraoperatively, but not only spend time with the patient postoperatively, communicating about discharge plans and how they're recovering and what their process is so far. We try to be that piece, puzzle piece, communicating with other team members, communicating with other practices, and working side by side with the physicians to care for the patient in a high quality level of care.
As a cardiac electrophysiologist, I'm involved in the care of very sick patients. These patients that we treat at Health First have very advanced comorbidities. We will have to sometimes tailor-make a plan for them. And when we collaborate, we're able to give them optimal outcomes that would rival any other tertiary care center as well.
There are multi-specialty meetings where we get together and discuss cases. Of course, we consult our colleagues, but I think it's more than that. I think there's really a culture of communication here that supersedes that. We all have very good personal relations. There's just a lot of mutual respect and very free lines of communication, all kind of putting our opinions together to come up with the right plan for the patient.
When you combine multidisciplinary expertise along with cutting-edge technology, we deliver personalized evidence-based care optimized to improve quality of life.
Cardiothoracic surgery is one of the most carefully scrutinized of any medical specialties. We've been submitting our results to the national database for years, and things that we monitor are complication rates, ventilatory times, number of transfusions the patients get, and being on the appropriate medicines at the time of discharge. I think the 3-star rating in the STS database proves in a very objective way that the care that patients get here is top-notch.
We can do a high-quality catheter-based intervention program with high volume, certainly comparative to places bigger than ours. We can also provide advanced technologies such as robotics, where we use the Da Vinci robot for all of our lung cases. We started that 12 plus years ago, and Dr. Intaki's kind of keep progressing it and is branching it out into other parts of our care.
We do robotic operations involving electrophysiology, atrial fibrillation management, control of risk of thromboembolic stroke in AFib, and giving patients options to stop taking blood thinners. And the results also are to the benefit of the patient with shorter hospital stay, faster recovery, and also achieving things that are difficult to achieve using open traditional approaches.
In cardiac, there's a kind of a constant change to the options that we can offer patients. There's new innovations coming down the pike every year. Our job in the community is to let the community know that you don't have to leave the county to get high quality, innovative cardiac care.
I went to Whole Foods the other day. I found, the cashier. She's like, "Oh my God, you welcome my mother. She's doing great, thank you." And that is, to me, why I've decided to stay here at Health First. That small town feel. Every day you can make an impact. Every day as we step into the hospital, we have an opportunity to give someone the gift of life. And to me, that's precious.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.